This is Alex, and he has agreed to be my patient for the video. Okay? Alright, so, hi, my name is Jenna. I'm going to be a physical therapist assistant. How are you today?
I'm doing pretty good. How are you doing today?
I'm okay. Before we get started, I'm just going to take you back to the room, and then we'll get started. I'll ask you some questions, and then I'll go over everything, okay?
Okay.
Alright. Oh, we're back in the room. Okay. So, I read on your chart that you're having some pain. Can you just tell me where it is, what it's, like, just tell me everything that happened, okay?
Yep. Alright, so a couple weeks ago I went and got x-rays done. They actually referred me to you for my lower back pain, and it seems like it's kind of radiating down to my back or into my legs as well. For the last couple weeks actually. It starts in my back and then goes into my leg and kind of falls asleep a little bit, but my legs are starting to hurt from it as well.
Okay, and how would you rate the pain?
I would say, honestly, the back is probably close to a 6 or a 7. The legs don't hurt as bad yet. They're kind of like a 3 or a 4.
Okay. Is there anything that really triggers like your pain and stuff, like either bending down, sitting down, doing whatever?
It's actually a lot worse when I sit down and when I'm bending over to pick things up as well.
Okay. All right. So before we get started, I'll kind of just go over everything. So what I have planned would be just to we're going to try to eliminate the pain as much as we can, obviously. Help strengthen your back there, because I did read in your chart that you may have a protrusion back there, which is that narrowing of your backbones is what, in lay terms, I guess. So we're really going to help strengthen your spine back here, so we can help build your strength back up. I'm going to do some extension exercises with you to help kind of centralize those symptoms a little bit. And then obviously I'm going to talk about what I'm going to do and why it's helping, what it's helping, stuff like that. And then also we have the traction set up for you, and we're going to put you on some heat, which will help reduce that pain that's going down into your leg, and also it'll help relax your muscles and help us so you're not having as much pain while we're doing the exercises, okay?
Yep.
All right. So the first thing that I would do, I would set him on the traction and put the heat under him. And some contras for that, for traction, are spinal infections, rheumatoid arthritis, osteoporosis, acute inflammatory disorders, spinal cancers or tumors, central spinal cord impingement, and then for the heat is decreased sensation to hot or cold, circulatory problems, acute inflammation, active cancer, fever, and radiation therapy. And then the parameters for the traction, for a lumbar disc protrusion, they don't really want you on it more than 8 minutes, so 8 minutes is the billable amount. To put the patient on, they're going to be in supine at a 90-degree hip flexion with a 30-degree angle of pull. You start at 20 to 25 pounds, but for therapeutic effects, you want to have a minimum of their half of their body weight. And then for heat, you're going to put 6 to 8 layers of towel down to protect from burning. Add extra if it's too hot. The time is normally 20 minutes, but since we would be billing for traction, I'd only do it for 8 minutes as well while he's on the traction table. And then erythema for 30 minutes to an hour after treatment is something that you also have to remind your patients that could happen, which is just like redness and blanching on the skin. Okay. All right. So then after that's done, we would do that for 8 minutes, like I said. And then, so then I'm going to start out with our extension exercises. So this is kind of just like a slow, gradual kind of movement to help get that extension back, because I know bending over is painful. So if we're making sure that we're doing those extension exercises, it really helps with helping decrease that pain and stuff. And like I said, we're going to centralize the symptoms by doing that. So our first, I'll take you through all 7 of the Mackenzie extension exercises, as we like to call them. So our first one, you're going to lay on the bed and you're going to lay on your stomach.
Okay.
And then if you want to put your hands down, whatever's more comfortable. And then you're going to lay your head off to the side. Wherever is like the most comfortable, whatever side. And because this isn't really putting you into flexion, this is just a spot to help extend the back a little bit. It's not too much. We would normally have you kind of just lay there just to kind of not go straight into like full extension right now, just because I know that you're having a little bit of more pain today. That's why we started you off with that traction. So by doing this and just laying here for a couple minutes, 2 to 3 minutes, it really helps start to get that extension in your back. So like I said, we do that for 2 or 3 minutes. And then the next one we're going to do are called prone props. So you're going to stay on your stomach, but what I want you to do is I want you to kind of prop yourself up on your elbows. Back up, yep, just like that, as far as you can go. You don't really have to hold this unless you feel like you need to hold it to get more of that extension, but normally we would just go up and down to really help with, yep, there you go. And you would hold them, oh, go back up. We're going to do them 10 times, and you're going to hold them up here for 2 or 3 seconds. But like I said, we're going to go up and down. And you don't have to do all 10 just for the video, just do like 5. Mm-hmm. And making sure you're really feeling that arch in the back right here. And if at any point any of these feel like uncomfortable or that you're having a lot of pain with, you just need to let me know and we can adjust it as we need, okay?
Yes, ma'am.
Okay.
Did you want to continue?
Oh, no, that's okay. And with this one, just make sure that you're keeping your elbows underneath your shoulders so you're really getting all of that extension in there. So for the next one, what we're going to do is it's called a prone. We do it onto our hands this time. So you're going to get up. Yep, making sure that your hands are right underneath your shoulders. Same thing, we're going to hold it 2 to 3 seconds, 10 times. Like I said, this is just helping with extension, helping centralize the symptoms. Hopefully it's not radiating down your leg. And then whenever you're done with that, you can stand up for this one actually. This is an extending extension. So what I want you to do is I want you to put your hands on the back right here. Yep, just like this. And what I want you to do, I just want you to extend while you're standing. And then you're just going to do that 10 times as well. This will help to increase the range of motion as well. Make sure you're not going up on your tiptoes or you're rocking. We want to make sure that we're staying in here and just really extending our back, and that's it. All right. So then our next one, I want you to get back on the bed, but I want you to get on your back. So this is what we call like a double knee to chest. So what I want you to do is I want you to bring both of your knees to your chest, just like that. And this helps to restore your forward motion as well, since it hurts for you to kind of bend down. So this is helping restore that forward motion. So this is going to help increase that motion as well. And the same thing, we're going to do this 10 times. We would do these twice 10 times for all of these exercises except the one that we started with. Are you feeling okay?
Mm-hmm.
Everything feeling fine?
Mm-hmm.
Okay. Not too painful?
No.
Okay. So for the next one, whenever you're ready, is I'm going to have you sit up on the edge of the bed. This would normally be done in a chair, but I don't really have a chair right now. So what I want you to do is I want you to just slowly reach yourself towards your feet on the floor down here. I want you to, yep, as far as you can go. And this also helps to restore that forward bending motion down in there. We're going to do the same thing 10 times. Really elongating. There you go. All right, and then the last one of these extension exercises is just we're going to do some toe touches. So I want you to go down as far as you can. If you can't reach your toes, that's okay, but make sure that you're keeping your back. You don't want to like hunch over or anything. You want to try to keep it straight as much as you can while you're reaching down, so you're not compensating for anything else. It's okay if you can't touch your toes. Some people have really tight hamstrings and can't reach there. Yep, so I just want you to go down with it. And then back up. Same thing, do that a few times. And just like all these other exercises, it helps to increase range of motion. It also helps to increase, to decrease the pain that you've been having. Feel okay?
Yep.
All right. So then the next thing that I have is we're going to do our stabilization exercises, which this helps protect the lumbar spine. So back here is your lumbar portion of your back. So we're going to strengthen this to help support it as much, so the narrowing of that spine doesn't keep getting, more narrow, and then that protrusion keeps coming out. So in order to do that, we got to exercise and strengthen that, just so it helps keep everything together. Okay?
Yep.
So the next thing that I have you to do, I want you to lay back down on the bed, please.
Face down.
On your back, sir. All right. I also forgot to mention, if they needed a pillow under their abdomens on any of the extension exercises that they were prone, you can also add those for more comfort. So this one is called pelvic tilts. So how I explain this to my other patients is that I want you to take your back here, and I want you to push it into the bed. And I really want you working on just this part and making sure you're keeping your tummy tight during these, because that's also going to help. So keep your head back, and I really want you rotating your pelvis more than anything. There you go. Good. And we're going to do this 10 times as well. We're going to do these exercises as well. And then whenever you're done with those, just let me know. Alright, so then the next one I really want you to bring your legs up here. And what I want you to do is I want you to do some marching while keeping your lower abdomen tight right here. That'll help strengthen all of that. And I want you to do 10 on each leg.
Okay.
Make sure you keep your tummy tight. those?
Yep.
All right. So the next one, a lot of my patients don't like doing because they think these are really hard. So these are called bridges. So what I want you to do is I just want you to bring your butt up off of the table. Yep, and you don't have to hold it or anything, but I want you to still remain keeping that tummy tight to help strengthen it. And I just want you to go up and down 10 times, okay? Good. Just like that. All right. Are you still doing okay?
Mm-hmm.
Okay. So then the next one I want you to do is I want you to keep one leg straight and one leg bent. Just like that. And I want you to raise this leg up as high as you can without pain, without bending of the knee. I really want you to keep this knee straight. And I just want you to go up and down with it. And I want you to keep your tummy tight with this as well. So make sure you're keeping that knee straight. If you can't pick it up without keeping it all the way straight past your knee, that's fine. You can just go as high as you can, okay?
Mm-hmm.
And same thing for both knees. You do both legs. So you can go ahead and switch both legs. Yep, there you go. Keeping everything tight in here. All right. And then the last one that I have for you is I want you to have both of your knees up. And what I want you to do is, while keeping your upper and lower back flat, it's okay if your hips move for this one, but I want you to just roll your legs side to side without taking your back off of the table, okay?
Mm-hmm.
Side to side 10 times each way. You could also make this harder by using like a TheraBall up under their feet, and that helps with trunk rotation as well. So what this is doing is helping with trunk rotation, so it's strengthening all of that. And keeping the tummy tight is the big thing for these exercises. You done?
Mm-hmm.
Okay, how you feeling?
I'm alright.
Alright, you can sit up right here. So, like I said, that's all I have for everything today. The way that your spine, obviously you have it all the way from your neck to back here. So what we're trying to do is we're trying to protect all of that and strengthen it, which helps with the front of you and the back of you, and helps you get rid of the pain that's going down your legs. And how we did, like I mentioned earlier, when we did that heat on your back, while we were doing that traction, which was pulling it, which was allowing the space between each of your backbones to kind of just be more elongated, have more space in between them, so they're not crushing each other like a protrusion does. So it's normal to have like redness on the back for about 30 minutes to an hour afterwards. That's totally normal. How's your pain now?
It's a lot better, actually.
Okay, could you give me a number on that scale of 1 to 10?
It's probably closer to a 4 on my back, and I can't really feel the pain in my legs right now.
Good. So you're scheduled up at the front for the next couple weeks, so we'll keep seeing you. We'll keep doing more and more stuff like this to help strengthen that and to completely eradicate that pain that you've been feeling, and hopefully really help your spine out right there by strengthening it and getting it all stretched out, getting all those motions back, that bending forward so you're not having as much trouble, because I know that you have to go back to work, and I know that you sit a lot at your job as well. So we'll help progress you to try to get you to have more advanced movements and stuff like that. Is there anything else I can help you with?
No, that's going to be it.
All right, thank you.
Thank you.
Have a nice day.
You too.